Welcome to the Lovers Lounge podcast, where we talk to experts and other guests on topics related to love, relationships, and sex. I am your host, Tina Love, and on this episode, we're going to be talking with Dr. Saketh Guntupalli. He is Associate Professor and Director of the Division of Gynecologic Oncology at the University of Colorado School of Medicine at Denver. Dr. Guntupalli is a leading national and international expert in women's cancer and has lectured all over the world on surgical expertise and molecular mechanisms of cancer. Doctor, welcome to the show.
Hi, thank you very much for having me.
Yes, it's a pleasure. I've had a chance to listen to you on some other podcasts and learned about your book. And so I said, well, I just have to get you on to talk about it. So, why don't you tell me a little bit about your book, the name of it, and a little bit about it, how you were led to write the book, especially.
So again, thank you very much for having me on your podcast. Um,
Yes.
so the name of the book is called Sex and Cancer, Intimacy, Romance, and Love After Diagnosis and Treatment. And the book is really devoted to women who are undergoing or have been treated for any kind of cancer. The book kind of focuses a little bit more on breast and gynecologic cancers, but really most of what's in the book is applicable to any cancer, whether it's lymphoma, leukemia, brain tumor. And the reason that I wrote the book was because I felt like there was a very important and unmet need that many women with cancer have, and that is how do they rebuild their intimate life after a diagnosis of cancer? And it's not something that many women, I think about at the time of their diagnosis. How is treatment, how is surgery, how is chemotherapy or radiation going to affect their sex life or their intimate life? And it is a very big problem. In our study that we did, we found that up to 70% of women who are treated with cancer have significant sexual dysfunctioning after treatment. So it's a prevalent problem in the many millions of women that are diagnosed with cancer every year. And we really wanted to have a tool for women to go to for them to kind of address or talk about these issues.
Right. And so basically, your book has several stories then, or it's a compilation of stories of different women's diagnosis, their treatment, their journey, so to speak. Is that correct? And sort of telling what they've experienced?
Yeah, so the book is really a series of 8 patient stories, and each patient story addresses a problem that generally women have with sexual functioning after cancer. So the first story talks a little bit about why I wrote the book, and it came out of an inspirational story from one of my patients
Yeah.
who basically had a diagnosis of ovarian cancer and ultimately was cured of her ovarian cancer. She had a very run of the mill cancer. She was 42 at diagnosis. And basically, she came into my office for a surveillance visit and she told me she was doing well. She was feeling better after getting, several months of chemotherapy. And then really just kind of broke down and, told me that since the day that she was diagnosed with her cancer, her husband had not touched her in any intimate way. And that really, really kind of just resonated. And just for some reason, it just really caught me a little bit off guard. And I thought about that the whole day. And she basically said that her and her husband were getting a divorce because after her diagnosis, they never had any intimate relations after that.
Wow.
And I thought about that a lot that day, simply because that's just something that had never really crossed my mind. I mean, I'm a surgeon. I've operated on thousands of women with cancer. I've given chemotherapy. We've worked with radiation oncologists to treat cancer with radiation, but we never really asked that question or, addressed that in the way that we should. So that story really is the foundation for the book and why it evolved the way that it did.
Yeah, so sad because, at 42, I'm sure, this kind of came out of nowhere of her diagnosis and having to go through this. And then to hear the response, I guess, that she got from her husband. And I would imagine they go through a lot too, being the spouse or the partner of someone who's had a diagnosis, maybe not really knowing, how to react or what's going to happen or how to communicate what they're feeling. And so I'm sure we're going to talk about that a little later in this interview. But Before we do, there are times then, doctor, where a woman may have to have their organs removed. So, like breast, ovaries, someone might have to have their whole uterus or vagina taken out or rectum. So, when those things happen, can you give examples of maybe some patients that went through this and some of the changes that occurred with them as it relates to it?
So I think it's really important to think about cancer treatment kind of in the three major categories that we treat. So we treat with surgery, we treat with radiation, and we treat with chemotherapy. So
Okay.
we'll start with surgery.
Yeah. Yeah.
So oftentimes, particularly for gynecologic cancers, we treat with surgery, and surgery revolves generally for big abdominal cancers, an incision on the abdomen. When we remove the ovaries, we remove the uterus. We do that, and that can create a substantial amount of scar tissue. So when people have scar tissue, it can be painful. It can be painful during intercourse. It can be painful during exercise. It can be painful during any kinds of physical activity. So one of the reasons that we think that surgery can cause sexual dysfunction is it can actually cause something called dyspareunia, which is pain with relation. So
Okay.
when a woman is having intercourse with her significant other, as that is happening, that scar tissue is being stimulated and it causes pain.
Yeah.
The other way in which surgery can cause, kind of substantial sexual dysfunction is because of issues of body imaging. And when we make incisions on people, they're oftentimes unsightly and not something that people are very proud, particularly women, to have on their bodies. And so I think that surgery can be both directly and indirectly a cause of sexual dysfunction for those reasons. Uh, I'll talk about radiation a little bit. So when we radiate organs, we are kind of taking away the blood supply to those tissues, even the normal tissues. So if you have decreased blood supply, those tissues can atrophy or become very dry. And obviously, for pleasurable sexual intercourse for
Mm.
both the partner and the patient, that area needs to be moistened or certainly not dry.
Right.
And that is another reason why a lot of women who get radiation to the vagina, to the pelvis, to the vulva, if they have a vulvar cancer, do experience pain with relations because that area has become very dry and cracked, and as a result, can bleed. So that can be very painful and very not very satisfying for the woman. The other issue is when we give radiation, it can actually impair the nerve
Mm.
to the clitoris, and thus sex is not as pleasurable, and it becomes a little bit monotone. So that's how radiation might affect sexual functioning. And then lastly, chemotherapy. And this is something that I think our group was one of the first in the really world to really kind of quantify, and that is to show that chemotherapy itself was an independent risk factor for the development of sexual dysfunction after cancer treatment. And that's applicable to really any cancer that is treated with chemotherapy. And there's several reasons for that. The first is chemotherapy will make you very tired.
Yeah.
It can cause anemia, which makes you fatigued. And if you're fatigued and tired, you're not going to want to have sex. So it
Yeah.
causes hypoactive sexual desire or impaired sexual desire. So that's one of the ways it does that. Now, the other way in which chemotherapy, particularly for women, causes impaired sexual functioning are issues of body image. And this is something that I learned writing this book that I didn't really pick up on the extent until I had written this book and done this research.
Right.
And that is that, hair is such an incredibly important part of a woman's kind of the way she presents herself as a sexual being.
Yeah.
And, it really took a patient to kind of really kind of hammer it in. And what she said she was walking through the airport in Denver. I practiced in Denver, Colorado. It was a huge airport. And she didn't have her wig on and she'd gotten chemotherapy. So she had lost her hair. And she said that it felt like a scarlet letter was on her chest, that everybody in the airport knew she was a cancer patient because she didn't have any hair. Because why would a woman in our society not have hair? There's really only one reason, and that is because she's got cancer.
Cancer. Yeah.
And it's different for men because for men, it's kind of a natural part of
Right.
the aging process that you lose your hair.
Turn bald. Yeah.
But that's just something that happens to men, but it doesn't happen to women. So that made her feel very less desirable and it made her feel unattractive or less of a woman. So I think that those things all kind of or an interplay as to why sexual dysfunction happens after treatment for cancer.
Right, right. Have a bearing on your sexual dysfunction and or sexual function anyway, and your, desire. You have some stories of when women have their breast removed,
Hmm.
and how important breasts are to us as women, and how that sort of impacts. So, can you talk a little bit about that?
Well, if you think about it, for women, and when you talk to women, what is the most outward sign of their sexuality or their femininity? It's their breast. It's
Right.
their hair and their breast.
Yeah.
That is what most women, not all, but most women will probably say. So when we do a mastectomy, we remove the breast tissue, that is incredibly damaging for women from a sexual or desire point of view. It's something that many women are very proud of their breasts, they're very proud of their figure, they're very proud of how they look. And if you take that away because you're surgically removing cancer, then that's very difficult. And so that is another thing that I learned a lot when writing this book is how important that was. Because I think for many men and for many partners, they just want their wife or their sister or their mom, in this case their intimate partner, they just want them to get better. So they don't really think about that. But for women, this is the most outward sign of sexuality, and so to take that away, I think is very damaging to a lot of women.
Yeah. I think it just does something to us mentally, just on how we think that we're being looked at or perceived. And so if we don't have that anymore, am I still sexy? Am I still,
Exactly.
you know what I mean? And so you've actually had stories of like women who've experienced that with their husband. Like they felt like, you know, they were not going to be accepted now, from their partner because their breasts were removed. However, the partner was more concerned with just making sure that, they're doing well. Is that correct?
Yes. So, in I think chapter 4 in the book, I talk about a young woman who is actually a physician. She's a OBGYN,
Right.
and she's actually a good friend of mine. And her mother passed away from metastatic breast cancer, and she actually very sadly developed breast cancer while she was trying to have a baby. And while she was kind of going through the fertility process, they found a breast mass, biopsied it, and it was breast cancer. And this is someone who was 34 years old, very healthy otherwise, and someone that really was very proud of her figure. I remember her calling me and telling me this, and she's like, I know what this means. I'm a physician. My mom had breast cancer. I know what the surgery is going to be involved. And she just said, I don't want to lose my breast. I'm very proud of my figure, and I worked very hard. And she was very devastated by that.
Yeah.
And it was interesting because her husband, he was obviously upset, but he was far more upset about how it was going to affect her than his kind of view of her as a sexual being. He's like, you're my wife. I will always look at you that way. I just want you to get better. But still, that kind of
Yeah.
feeling of loss, immense feeling of loss, is very important to, I think, at least acknowledge.
Yeah. Exactly. So I want to move towards now. You were talking about earlier, say for instance, your vagina being removed, or radiation to those areas, and how the discomfort, and so then probably couples will need to figure out other ways to, enjoy or have sexual pleasure, or um, share intimacy with each other. So, can you talk about alternatives, or things that the women have learned and that they've changed in their relationships to kind of get around some of the issues that they have as a result of the surgery or the radiation or whatnot?
So I kind of, whenever I talk to a patient about how do they kind of restart their sexual or intimate life after treatment for cancer,
Yeah.
it's a kind of a multifaceted approach. The first is you have to realize that it's going to be to some extent a new normal. Like, what is your new normal? The reality is it's probably not going to be completely the same. There
Hmm.
are going to be some changes. That doesn't mean it won't be pleasurable or it won't be fun or they won't enjoy it, but it is going to be a little bit different. And both partners need to understand that. So the way I kind of approach this thing is the first and most important thing to do is to communicate, communicate, communicate with your partner. And that seems like a very kind of overused and trite kind of thing to say, but that's probably the most important part of rebuilding your sexual life. after a diagnosis of cancer is talk about what your expectations are. For the patient, they may not have as much desire, or they may not have some of the, kind of ability to have some of the, the orgasms or the things that they had before. And it's important to at least acknowledge that. The second thing is, and I tell this to patients all the time, the single best intervention that you can do to help rebuild your sexual life that's the lowest cost and the easiest is to use a good lubricant. And I always tell patients to really, really get a high-end, suave, non a lubricant that doesn't have any odor to it because some odors are off-putting to people, and use that before sexual relations because that is probably the single biggest intervention that you can do to improve your sex life. In the postmenopausal period, the vagina becomes drier. After treatment for cancer, the vagina becomes drier and it becomes less pleasurable for both parties if you don't use a good lubricant. So I think it's incredibly important to use a high-end, suave, generally water-based lubricant. And then the third thing that I always tell patients is very, very important is to think of sexual activity. You have to think of sexual activity outside of the box. And it's not just about, foreplay,
Mm-hmm.
climax slash orgasm resolution. I
Right.
mean, that's not the way that's not how we should think about sexuality and sex in kind of a more modern approach. Sex can be holding hands naked. Sex can be, or intimacy can be driving through the mountains holding hands. Intimacy could be visiting an adult store. Intimacy could be doing something that is pleasurable for both parties, and it doesn't have to include intercourse all the time.
Right.
Maybe 70% of the time it'll include that, but it doesn't have to always include that. And to think about sex from a little bit of a broader vantage point, and intimacy certainly from a broader vantage point is going to be very, very important.
Right. I think I heard a story where you talked about a lady who she found a different way to like feel the intimacy between, you know, she and her husband, and that they were motorcycle riding and just
Right.
being up close to that person on a motorcycle, that was another way of being intimate with her husband. Can you kind of expound on that, just kind of how they were to arrive at maybe some of these different ways of feeling that intimacy?
So I think that that's the fifth story in the book, and we talk about a couple that really had a very devastating cancer diagnosis. She had a recurrence of her cancer, and that required removal of the vagina, the rectum, and the bladder. So not only did she have removal of the vaginal canal, she had a colostomy and a urostomy.
Yeah.
And that was a completely devastating procedure for her to do. But she was 48. It was curative. She's still alive without evidence of disease now, 8 years later. But it was devastating for her. And she, in essence, told her husband, you're 49 years old. You're still very functional. We should divorce, and you should be with someone that can be with you in a quote unquote normal sexual way. And he just responded like, "Why would I do that? I'm with you to be with you, not just because of your vagina." And so I think that was kind of the start of rebuilding that intimacy and that kind of relationship. And subsequent to that, I think they found ways to be intimate that didn't just involve intercourse. And she still has orgasms, and they still have a very fulfilling sex life. And it's different. It's not exactly where I think they thought they'd be at age
Right.
55,
Yeah.
but
Yeah.
it is she says, in some ways a better place, a more real place, and they've grown closer and understand each other and are with each other, and they have a very deep connection and deep bond, and that's how they've rebuilt their life. And some of it is, riding on the back of a Harley through the mountains of Colorado. Sometimes it's visiting an adult store. Sometimes it's, you know, oral sex. Sometimes it's just lying naked next to each other. Sometimes it's being in a hot tub. So it's different, which makes it more exciting and thus makes it pleasurable.
Yeah. Yeah. That's really neat to hear that you're able to kind of step outside of the box, so to speak, and just think, in different ways about sexual pleasure and intimacy. That's really neat. So I want to go back to the emotional part of this. When a person gets a diagnosis, there's things going on emotionally for probably both parties, right?
Hmm.
The person who's received a diagnosis has a lot that they're thinking about, and then the spouse or the partner has a lot going on. So, what would you say is the most important thing that both of them need to do after having a diagnosis or experiencing treatment or whatnot? What's very important that
So,
they do as a couple?
so first and foremost is communication. I think that again is something that's kind of overused term in our society, but I can't emphasize it enough. Really communicating with each other and talking about what intimacy is going to mean for both partners is so incredibly important. And again, it's going to be different. It's not going to be exactly 100% the way it was before treatment. So really talking about what expectations are, what is pleasurable, what is not pleasurable. Maybe the woman has had a lot of surgery and has a lot of scar tissue, and maybe intercourse in kind of your standard missionary position is going to be uncomfortable. Maybe she needs to change positions, or he needs to change positions in a way that's more comfortable for her. So communication is the single most important thing that you can do, and it's just something that I cannot emphasize enough. I'll give you a great example of that. I had a
Yeah.
patient in my practice 2 years ago, got treated for ovarian cancer, did great. At the end of her treatment, this is after I wrote the book, so I said to her, well, have you started having relations again? And they both got very quiet. I said, what's wrong? And they both just said, well, no, I haven't had relations yet. We were kind of waiting, and they got kind of quiet. It was a little bit awkward. And in essence, he did not ask her because he did not want to come across as that was the only thing that was on his mind.
Right.
And she wanted to have sex very much for the last few months, but was waiting for him to initiate it and felt kind of rejected by him because he didn't initiate that.
Uh,
So they both wanted to have sex with each other and both wanted to be intimate, but because they weren't communicating, nobody knew that. And this
yeah.
is a couple that's been married for 30 years. So, you know, I think that communication is so incredibly important.
Right. Right. And something else, I think I also heard you talk about on another podcast about it was almost as though the person who had been diagnosed was pushing the other person away. And they were kind of in your office one day and they're talking and you could sense that there was a problem, but they weren't talking about the partner wasn't speaking up for himself, but she was saying all these negative things about him, and then finally you were able to talk to the partner. Do you remember that story? Can you tell a little bit about that?
Yes. So one of the things that happens in relationships and intimate relationships where one of the partners has a chronic medical condition like cancer
Yeah.
is there is the caregiver and then there's the person that's being cared for. And there can be some resentment that develops on the part of the caregiver because they're doing so much. And I think it's really, really important for patients to show that appreciation to the caregiver. And I'm talking about the person that doesn't have the cancer or the chronic medical condition. And so that's incredibly important because those people have issues and they can feel overwhelmed, but they're not allowed to show it because they're not the person with the disease.
Yeah.
So I think that that's really important. And in this situation, what was happening is a woman with uterine cancer got chemotherapy, beat it, was doing great, no evidence of disease, and would constantly abuse verbally her husband and said, you don't understand, you don't care, you don't understand, you don't care. And, it reached a point where she was being kind of so abusive to him
Yeah.
because she was so scared about her cancer coming back. And this is the way that she was manifesting that she was really pushing him away. And they actually had to separate for some time. And I think they're back together and doing well. But you've got to remember that cancer kind of takes its psychological effect around everyone around you, and you've got to keep that in mind.
You use some term. I cannot remember it for the life of me. But it was almost like beating this person over the head. I don't know what it is. It was a term that you used that a form of abuse that she was doing to him. I can't think of the word at this time. I
Yeah,
don't know if
it's
you can.
it's called a damn it doll. So
Yes, damn
a
it, doll.
damn it
That's it.
doll
Yes.
is a doll that you buy. It doesn't really have a face or a gender or anything. It's just kind of a doll with a little bit of kind of hair at the top, and you kind of take it. It's made out of cotton. You kind of beat it when you're frustrated, and you can't use your significant other as a damn it doll
Yeah.
because you're frustrated about something else that's going on.
Right. Right. Something else I think is just very important to mention when you talk about communication is sharing the feelings. Like I know that you've said in other interviews about how important it is, even if you are scared or if you are, confused or whatever, that it's just very important that both parties share their true feelings about what they're going through and what they're experiencing. Can you kind of expound on that?
I'm sorry, can you repeat that again?
I was going to say, can kind of expound on the fact that you talk about with communication that it's very important that each person sort of share what they're feeling. If they're scared, they should they should share that they're scared or they're confused or can you kind of share the importance of that, sharing those feelings?
So, again, the reason it's important to communicate about those type of feelings and those type of things is because, cancer is a scary thing to happen to anybody. It's particularly scary to women and really scary for younger women because a lot of times they have young children. That's the first thing that they think about. And the first story that I write in my book, I talk a lot about how this woman, this 42-year-old who was diagnosed with metastatic ovarian cancer, the first thing that she thought about was her two boys, and she was like, "Who's going to watch them and take care of them?" So there's this really big emotional and fear component that happens when a woman gets cancer. And I think if you don't talk about it, acknowledge it, talk to either a therapist, your significant other, your friends. If you don't voice that, it's going to get pent up and it's going to manifest itself in other ways.
Right. Okay. Yeah. So very, very important. And it's interesting because, in doing this show, Doctor, what I've noticed, communication seems to come up just about on every episode, some way or the other. And to me, though, it's something that, you think everybody can do or is able to do. But interestingly enough, sometimes we find it very difficult to communicate and be able to communicate clearly with each other. And so, anyway, I find that very interesting. All the time we come back to communication and how very important it is in everything.
Yep, definitely.
All right. So, can you give us one more time? Tell us the name of your book, and if you'll let the listening audience know how they can obtain the book and how they can hear more from you about maybe some articles that you write. I know you've written a lot. So can you tell us about that?
So the name of the book is Sex and Cancer, Intimacy, Romance, and Love After Diagnosis and Treatment. It is available on Amazon. So if you type that or you type my name into Amazon, you would be able to find it. And it's a very quick read. It's only about 200 pages and it's patient based. So I definitely think uh, patients will be able to relate to the women in the book. And this is just a topic that is very important, and I'm glad I can be an advocate for something. I'm a surgeon. I treat cancer. I do a lot of research, but this is a way that we can really, on a daily basis, really help our patients, and I think it's a really good thing.
Do you have any social media that people can follow you on or website, did you say?
Yeah, so our website is Colorado Women's Health /cancer, and there's all sorts of information on the website on sexual dysfunction and how to address it and ways to engage with it. So happy to have patients go there or people go there, and they can contact me from there as well.
All right. Well, thank you so much, Doctor, for coming on the show.
Thank you very much for having me. I really appreciate it.
Okay. Well, uh, listeners, I hope you guys have enjoyed listening to the Lovers Lounge podcast, where we talk to experts and other guests on topics related to love, relationships, and sex. So, this is what I need. I need for you guys not to forget to subscribe, to comment, to rate, or to like the show. It just kind of tells me, what types of topics you guys are most interested in hearing about. And who knows, it could keep me around a little while longer. Thanks again. I am your host, Tina Love. And until next time, peace. And of course, don't you forget, love.